Isa sa mga usap-usapan ngayon ang paglalabas ng World Health Organization ng COVID vaccine booster moratorium hanggang sa katapusan ng taon. Alamin natin ang kabuuang detalye patungkol dyan kasama si WHO Representative to the Philippines, Dr. Rabi Abeyasing. Magandang umaga. Good morning, sir.
Magandang umaga, Secretary Martin Nandanay.
Dr. Rabi, why did WHO call for a vaccine booster moratorium? What is the current situation of the global vaccine supply?
Thank you, Secretary Martin. It's a very important question because, as we have highlighted, there is still a huge vaccine inequity issue globally. And some of the most vulnerable people in the world have not been able to access even a single dose of the vaccine. In light of this, WHO is asking for a moratorium on booster doses. But let me also clarify what we mean by a booster dose. It means a third dose for people who have already received 2 doses of a vaccine. And really, we don't have the evidence that people who've already received 2 vaccine doses of WHO-approved EUL-granted vaccines require a third dose. The evidence we have, looking very closely, is that all WHO EUL-listed vaccines still are effective in preventing severe disease and death. And the only exception to this is when those 2 doses have not been able to generate the required immunity because certain people have immunocompromised situations in their bodies. And those people may require a third dose. Now, when we're talking immunocompromised people, it may be elderly, it may be people who have other immune problems that may require a booster dose. Besides that, we are not seeing a need for population-level booster dosing at this point of time. This is an evolving situation. WHO is working very closely with many of our research institutions and partner organizations to gather better evidence. But in the interim, our current position is that since the vaccines are effective in preventing severe disease and death, that it is more important to address the global inequity in access to vaccines. For example, if we look at it, WHO requested countries to ensure that 10% of the most vulnerable people are fully vaccinated by the end of this month in September and 40% by the end of this year. If we look at it, 90% of high and high middle income countries have already reached that 10% target. And more than 70% have actually reached the 40% target. But unfortunately, not a single low and middle income country has reached the target, either of these targets. So we are nowhere near vaccine inequity, and the problem actually is that as long as there is vaccine inequity, as long as there are vulnerable people who are not protected, we leave room for the virus to multiply, leave room for surges of outbreaks, whether they are driven by new variants or not, and this then results in further mutations. So that is why WHO is urging for a moratorium on booster doses unless they are absolutely indicated in the case of immunocompromised individuals, so that more equity can be achieved globally through vaccination. Thank you.
Would you say, Dr. Rabi, the WHO Director General said that this decision is to help low-income countries to vaccinate at least 40% of their population. Now that the Philippines have only vaccinated around 15%. Now, do you think that the 40% by year end is attainable?
We continue to work with the Philippines government, as with many other governments, to ensure that those 40% targets are achieved. I might remind you that WHO, through COVAX initiative, agreed to provide enough vaccines to protect 20% of the population, the most vulnerable populations, by the end of this year. We have already provided 13 million doses. Those 13 million doses, 3 million doses were single-dose J&J vaccines, and 10 million were double-dose vaccines. So those vaccines have been able to fully protect 8 million people already. We are looking at increasing vaccine allocations for the Philippines. Actually, we have some good news this morning. COVAX has allocated a further 10 million doses to come to the Philippines within the next few weeks. So we continue to, and this was what we expected. We expect much larger consignments to come within this third and fourth quarters to the Philippines and to many other countries who are recipients of COVAX vaccines. And so we will be mobilizing larger and larger quantities of vaccines so that we achieve that 20% population protection before the end of the year. Thank you.
What is the reaction of the vaccine producing countries to this moratorium? Will they comply?
Well, it's a complex issue because, as we said, we are looking very carefully at the evidence, and the evidence right now shows that the available vaccines are effective in protecting from severe disease and death. We also note that the evidence is that the currently available vaccines, when people are fully protected with them, protect against the circulating new variants. So really, there is no justification at this point of time for a booster dose unless it is for immunocompromised individuals. And this is also a space that we are looking at because it's pretty complex. If we are talking of a third dose of which vaccine? Is it the same vaccine? Can we look at combinations of vaccines? We simply don't have the safety information. So it's about the efficacy information and the safety information. And that's why we are saying we are working to gather better evidence so that we can decide and recommend on policy issues. In the interim, we see that the biggest benefit will be by addressing inequities and providing vaccination coverage to as many people, especially the vulnerables, as quickly as possible.
Dr. Rabi, how about the people, for the people coming from the vulnerable sector? Will there be a compromise as to when and how they can receive their booster shots?
There is no, right, like I explained, Secretary Martin, there is no need at this point of time for booster shots for people coming even from the vulnerable groups. The only group that may require a booster are those immunocompromised individuals. So we are looking very closely at the evolving evidence, and we don't have a recommendation as yet that vulnerable people require a booster unless they are immunocompromised. When we have better evidence, we will be in a position to recommend such a recommendation, provide such a recommendation. In the interim, we continue to say that the best use of vaccines will be to vaccinate the unvaccinated vulnerable people. Thank you.
with cases tallying from 20,000 to 26,000 a day, can you say that the Philippines is the new epicenter of COVID-19 in Southeast Asia? And do you think that our healthcare system can still bear the surge that we are experiencing right now?
We have noticed that with the predominance of the Delta variant globally, many countries, particularly in this part of the world now, are experiencing surges. Several countries in our region are reporting in or around 20,000 or excess cases. And this is not unique to the Philippines. This was expected. In fact, that's why we were working before the Delta variant came, looking at the experience of other countries affected by the Delta variant to push for vaccination of the most vulnerable elderly groups so that we could prevent them falling sick, developing severe disease, and causing a surge in the healthcare facilities. We have made progress, but unfortunately the progress in the Philippines has been painfully slow. We still have nearly 3.6 million elderly people who have not received a single shot. This is unfortunate, it is unsatisfactory, it's also a reflection of the inequity that we are seeing globally happening within country, which we need to correct urgently. So as COVAX delivers more and more vaccines, we urge for protecting the most vulnerable as quickly as possible, and that includes the elderly, because we see that 7 out of 10 deaths in the Philippines are reported in this group of above 60. So if we really want, we want to protect lives, and if we want to protect lives, we need to use the vaccines that are coming to protect these people. So yes, we are seeing increase in transmission. We are actually seeing more than double the number of active cases that we saw during the surge in April. But so far, the healthcare system has been holding up, and that's largely because we are seeing fewer cases among the vaccinated, particularly here in NCR, where you have about 80% of your elderly fully vaccinated. So this is good, but there are areas in the country where the elderly vaccination coverage is just over 24%. This is unsatisfactory. We need to correct this as quickly as possible, because we are seeing a surge affecting many other regions, and many regions in the Philippines, the elderly coverage is still below 40%. So we need to do better, and we urge the local chief executives and the local health authorities to prioritize, to create avenues so that these most elderly people can be vaccinated and their lives protected. At the same time, we also need to make sure that with this unprecedented number of cases, we do everything possible to reduce and control transmission. And that includes our non-pharmaceutical interventions, our quarantine levels, how we manage that. We need to be very careful that in our messaging, we don't send the wrong signals to the population. We need to ensure that the movement restrictions that have allowed us to hold at this level are maintained till we see a decrease in the transmission trend. Because if any changes in the policies result in a further increase in transmission, this could result in an overwhelming of the already stretched healthcare facilities. So let us be very careful in addressing this evolving situation. It's about vaccinating the most vulnerable people, but it's also about ensuring full compliance with the minimum public health standards. This is the way we can break the chains of transmission and reduce the transmission and protect more lives. It's important. WHO has, from the beginning, stated that we want our 2 priorities in this response to the pandemic is protecting lives and protecting the economy and allowing for economic revival. But to do that, First and foremost, we need to ensure that our hospital systems are not overwhelmed, our healthcare workers are not overwhelmed. The way to do that is to prioritize vaccination of the most vulnerable, elderly and comorbid populations across the country. We should not create inequity within the country when we are vaccinating our people. Thank you.
Is the number of vaccinated population of Metro Manila already enough to drop the stricter restrictions previously implemented by the IATF?
We have significant population coverage within NCR. I believe it's about 60% now. But this is not adequate at this point to relax our quarantine positions. Now, you may recraft the terminology, but basically what we are advising is make sure that those restrictions are followed, that we don't relax too much, because we are not in a position where we can relax and experience a further worsening of this transmission level, because our health systems are just holding up. If there is a further increase in the current transmission levels, it could lead to an overwhelming of the hospital systems. That's why we need to be very careful in calibrating how we respond to the current situation.
We have some media questions. I'll turn you over to Yusek Rocky Ignacio.
Thank you.
Good morning, Dr. Rabi. From Caroline Bongkin of CNN Philippines. Will the WHO consider giving a special consideration or exemption on giving booster shots to health workers?
Yusek Raki, I just explained that we don't see a need at this point of time for universal booster doses for all healthcare workers. Among healthcare workers also, there could be immunocompromised individuals, and there may be a need for those individuals to receive a booster shot. But universal administration of booster shots for even healthcare workers at this point of time, WHO does not have a recommendation to support that.
Dr. Rabi, this question is from Red Mendoza of Manila Times. Critics of the Philippine government response for COVID-19 say that the country cannot do its experiment anymore on granular lockdowns and instead focus on harder lockdowns and giving financial aid, which the government is not anymore capable of. What does the WHO say about these criticisms of the response?
Yusek Raki, it's a good question. I'm not addressing the criticisms per se. What I'm saying is that in the light of the current levels of transmission, we need to maintain the levels of restriction that have helped us to hold the current levels of transmission and not create a situation where it could increase. Now, how those levels of restrictions are implemented, whether they are called quarantine classifications, whether they are called granular lockdowns, does not fundamentally matter. The issue is that the people and other stakeholders need to realize that there is continuing transmission, that there is an important element that we need to reduce movement, we need to ensure compliance with the restrictions, because if we relax further, it is likely that with such a transmissible variant here, we will see more cases. So what it is called is immaterial as long as we message clearly to the public that we need to follow the restrictions so that we reduce the transmission. This is what is most important at this point of time. Thank you.
Dr. Rabi, his next question still Red Mendoza of Manila Times. A columnist of our paper said that the WHO has been pandering to the DOH because of your continued support to the wearing of face shields, and should speak more frankly on the faults of the government's COVID-19 response. What can you say about this?
Our position on face shields has been articulated quite clearly several times, so I don't need to reply to this question again.
Dr. Rabi, what is your parting message to the public?
Our parting message is that we are in a very critical situation. We need to do everything possible. We need to ensure that our most vulnerable have access to vaccines and are vaccinated fully. We need to ensure that everybody does everything possible to follow the minimum public health standards and ensure that there is less room for transmission. And that is everybody's responsibility. Every individual needs to do the maintaining of the physical distancing, the hand hygiene, the wearing of masks, so that we can ensure that there is no continuing transmission of the virus and we can break the chains of transmission. If we are having signs and symptoms, we need to quarantine, isolate, get ourselves tested. We need to improve our testing regimes. We need to improve our contact tracing mechanisms. We need to further expand our healthcare system so that we can manage the increasing number of patients who require the support when they develop severe disease. And we need to communicate quite clearly that the risk is not past. We still have a long way to go in this battle, and we need to continue to work together in unison to ensure that we can reduce the transmission and come out of this situation. Thank you.
To the Philippines, Dr. Rabi Abeya Singh. Stay safe, sir.
Thank you so much, Secretary Andana.